Hello and welcome to MediByte, your go-to source for clear, reliable health information. Today, we're going to talk about a topic that understandably can cause a lot of worry for parents, and that's a pelvic mass in a female child. Our goal here is to just walk you through what you need to know, step by step, to help you understand what it all means.
So that's the big question, right? What does it actually mean when a doctor says your child has a pelvic mass? The term itself can sound pretty alarming, but honestly, understanding the basics is the best first step you can take. So let's break it down.
Okay, so first things first, let's just cover the fundamentals. Before we get into anything else, we really need to know the basic definition and just a little bit about the anatomy involved. Simply put, a pelvic mass is just an abnormal growth that's found in the pelvis, which is that lower part of the abdomen. Now, it's important to know that these are pretty uncommon in children, but they do happen, so it's good to know exactly what we're talking about. So, when you picture the female pelvis, it's home to several different organs. You've got the ovaries, the uterus, the bladder, and parts of the intestines. A mass can potentially form in any of these places. So, what does this actually look like in real life? What are some of the signs you, as a parent, might notice? Let's talk about what you should be on the lookout for. You know, sometimes a pelvic mass causes no symptoms at all, and it's just found by accident during a checkup for something else. But if symptoms do appear, they might include things like pain in the pelvic area, maybe some unusual vaginal discharge, nausea or vomiting, or even signs of puberty starting a bit earlier than you'd expect. If you notice any of these signs, of course, the next step is a visit to the doctor. And knowing what to expect during that evaluation process can really help make the whole experience a lot less stressful for both you and your child. You'll find the process is actually very methodical. First, the doctor will just talk with you and your child to get a full medical history. That means discussing the symptoms and if there's any family history of cancer. Next up is a gentle physical examination. And then finally, if it's needed, they'll order some further tests to get a more detailed look. The goal is always to get information without causing any fear. So, what kind of tests are we talking about? Well, usually the very first one is a pelvic ultrasound. It just uses sound waves to create a picture. If that's not quite clear enough, an MRI might be the next step. And, depending on the symptoms, a doctor might also order blood tests to check for infection, or hormonal tests if early puberty is a concern, or even test a vaginal sample if there's discharge. Now, this brings us to a really crucial question. Why do these masses happen in the first place? Well, it turns out the most common causes actually change quite a bit depending on how old your child is. And this is where age really makes a big difference. For newborns and infants, the most common thing we see is something called a follicular ovarian cyst. These are often just caused by the mother's hormones from pregnancy. Now, in older children, a mass could also be a cyst, or more rarely, a tumor. But, and this is reassuring to know, the most common type of ovarian tumors in this age group are called germ cell tumors, and they are usually non-cancerous. Okay, so after a diagnosis is made, what's next? Let's talk about the path forward, and that includes treatment options and, of course, the most important points for you to remember. The treatment plan is always tailored specifically to the type of mass that's been found, and it's really important to know that not every mass requires some kind of big intervention. For example, some benign or non-cancerous ovarian cysts might just be monitored for a while, but they may not need any active treatment at all. So when is surgery an option? Well, a doctor might recommend it in a few specific situations. For example, to get a closer look at a tumor and remove it if there's any concern it could be cancerous. It might also be needed if a mass is causing other problems, like interfering with normal menstrual flow. When you boil it all down, the real key here is empowerment through knowledge. Just understanding the signs to look for and knowing the careful step-by-step way doctors evaluate the situation, that is the most important tool a parent can have. All right, let's do a quick recap of the most vital things to take away from all this. First, a pelvic mass can be either benign, meaning non-cancerous, or malignant, which means cancerous. Second, remember that in newborns, these are very often just simple cysts from maternal hormones. Third, in older children, the most common ovarian tumors are those germ cell tumors. And finally, imaging tests like an ultrasound are the main tool doctors use to check things out. If there's just one thing you take away from our time together today, let it be this. Your awareness is your most powerful tool. Understanding the potential signs and not hesitating to seek a professional medical evaluation is always, always the right and most important first step. Thank you so much for joining us for this MediByte explainer. We really hope it's provided some clarity and maybe a little reassurance on what can be a really complex topic. If you found this information valuable, please consider sharing it with others who might benefit. And of course, don't forget to subscribe to our channel for more straightforward, reliable health explainers just like this one. We'll see you next time.